Rosemary DeFelice managed to keep her Alzheimer's from her family, including daughter Cindy, for quite a while.
By the time it was really discovered, she was fairly advanced and unable to even have these discussions.
Discussions about whether she wanted a feeding tube at the end of life.
Our study shows that the decision to insert a feeding tube is more about which hospital you are admitted to, rather than decision-making that elicits patients' choices and respects their wishes at the end of life.
Dr. Joan Tino from Brown University led research looking at just over 163,000 nursing home patients 66 years or older with advanced dementia at almost 2,800 acute care hospitals with 30 or more nursing home admissions from 2000 to 2007. The study appears in this week's JAMA, Journal of the American Medical Association.
Hospitals that were more likely to insert a feeding tube were hospitals that had a practice style of aggressive care at the end of life. They were larger hospitals, and they were more likely to be for-profit hospitals.
The study also shows a wide variation in the number of feeding tube insertions.
If you were in the highest rate of using aggressive care, about 1 in 10 people had a feeding tube inserted. If you were in a hospital that was in the lowest rates of aggressive care, your rate of feeding tube insertion was only 3 out of 100.
Additionally, 12% of the hospitals used no feeding tubes during the 8-year study.
Hospice educated me a bit about the feeding tube and the fact that it can extend life only for a few months, more than likely, and that there's potential complications. So I opted to not put a feeding tube in my mother.
Catherine Dolph, The JAMA Report.